Thank you. Yes, so hello everyone, I'm Claire Woolcock. I am, as Nadji said, I am the Interim Chief Medical Officer. I've been in post for 7 weeks at Sussex Partnership, so still learning everything that it entails. So when Rick, who was the outgoing Chief Medical Officer, said one of the privileges was to come and he passed on the 15 minutes to come and talk to you all at this conference, my immediate thought was, oh my goodness, I'm probably the least qualified person around who could come and talk about dementia or research. Then he suggested that actually it was to talk about culture. I felt much more on an even playing field again to actually to come and talk to you. So thank you very much for inviting me. And isn't it amazing that we've got over 300 delegates online? It's one of those advantages of digital working, isn't it, that actually we can now get so many people to come together for such an amazing event. So thank you very much. And I also am aware that while the title of what I've been asked to talk about is why we need a culture of research, I'm also assuming that all 350 odd of you probably all think it's a good idea already, or else you wouldn't be here. But I think just to maybe give it from my point of view and from my point of view, Sussex Partnership point of view, and I think probably the NHS organisation point of view as to why that is so important. So what are we talking about? Why, when we say why we need a culture of research, what is culture? So, the easy way of describing culture is to say culture is the way we think we do things around here. So just saying, oh, well, doing research, that's just what we do here. Wouldn't that be nice? But I think there's something more behind that. And it's not just about the way we do things, but it has to be purposeful, doesn't it? And it has to gain something. So another definition of culture is the underlying values, beliefs, and perceptions that underpin an organization's management system, as well as their practices and behavior. So it's the values, it's what we believe in, it's then what we do. And I think the third bit is, I think, even the most important bit around for the sort of culture of research is it enables you to cope with problems and adapt and learn. So we're talking about what we value and the values that we have that underpin what we do, how we put that into practice and how we learn. And I think that encapsulate sort of really what is important about research is about that learning. And certainly for an organisation, thinking about the culture within an organisation, within a trust like Sussex Partnership, we are really very keen on being, pride ourselves on trying to achieve and always aspiring to be an organisation that is future focused, that is learning, that is about growth. And clearly having research, whether that be in dementia or any part of the services that we are delivering, is about thinking about the problems that we have and not just thinking about how we're going to do something here and now, but thinking about what's our direction of travel? How are we learning? How are we growing? And what are the things that we are doing as an organisation to grow in that way, to develop new things? I also think that culture permeates from the organisation down to the staff, the people who work in the organisation. And certainly one of the things in the last couple of years that I've seen working in Sussex is a culture of research where research is about feeling and aspiring to succeed, bringing improvement to the services that we're trying to deliver. I think everyone, when you join working in mental health, everybody wants to do their best and to aspire to do well for the people that we're looking after. And research in a career, in somebody's work, enables them to feel and build in a feeling of success, an aspiration for success. And that is part of what builds uh, careers that feel meaningful and are developmental. I think that helps us then to keep people in work, for people to come into work feeling that joy in work, that by having that aspiration, it brings joy. And the third part of the culture in which sort of where the culture of research affects is clearly around our patients. And I've seen, there's the program of the conference today talking about the impact of research on patients, and I think that is really, really clear. And why is the culture of research in a service, how does that affect patients? I think it brings hope. A very personal story, my mother passed away a number of years ago. I've got no personal experience of research in the mental health sphere, but my mother had breast cancer, and she was fortunate during her time when she was unwell to be involved in a number of research projects at the Royal Marsden. And I could see for my mother and for my father how important that was, and what hope that brought to them. After she passed away, my father has gone on to set up a charity, particularly looking at funding research in the particular kind of cancer that she had. And I think it brings him great hope and promise for the future that he's contributing to, to stopping somebody else from having the kind of outcome that my mother did. And so I guess in that very personal way of understanding that even when you think, well, actually, this isn't hope necessarily for me, but it's hope for the future of the people who will come after me, and what research will contribute to their pathway. So I guess that's my sort of very brief contribution to the to your conference today. But I think just to recap, I think the way that a culture, why we need a culture of research, it's for growth, it's to bring joy, and it's to have hope. So I wish you all the best for the rest of your day, and thank you again for letting me come and talk to you and share my story. Thank you.